Hi, everybody. So my name is Jobin Varughese. I am a family physician. I've been doing that for about 15 years. And within that time, I've worked within the sectors of the long-term care, within the hospital, and within the office. As I've kind of gone through my career, I've seen patients within each of those areas, but also I've started to do more and more work within administration and education, specifically medical education. And so my roles that I hold now, in addition to being a family physician, is I'm interim assistant dean of primary care education with the Toronto Metropolitan School of Medicine, Toronto Metropolitan University School of Medicine, and with the William Osler Health System as the Associate Vice President of Academics, in addition to being the President of the Ontario College of Family Physicians. And so each of those roles have been important to increase resources for family physicians, as well as increase the number of family physicians that are trained and that are able to be supported in the system.
Yeah, that's very interesting. I've also seen that you are the chief medical officer of something called Current Care. And I just read the brief description on your LinkedIn and it seemed very interesting. Could you just give a bit more information on what that is?
Yeah, absolutely. So Current Care is a health tech company that's really working to look and see many of the different challenges that can be present. And so one of the products that we have was O-Band, which is a health hygiene wearable, allowing us to help long-term care workers really understand where everybody was in terms of their hand hygiene. Because we know that having health-acquired infections can be quite a dangerous thing. And so it was a way of being able to signal to each other when somebody may need to perform their own hand hygiene. Our newest product, and something that we're really proud of, is Sensora, which is a sensor-based technology that helps people live in the place that they want to longer, especially those who are homebound or that may want to keep their independence. And so Sensora is a non-invasive, non-visual recording device that sits in the home or in a retirement home in some cases. And it allows people, family members or caregivers in general, to be able to work with their loved ones and say, I'm just going to check in on mom, but I don't want to necessarily put a video camera in there. How's her mobility been? And has she been moving around and things like that? So obviously this would be with the loved one's involvement. And so it would be a way of being able to help people stay in their own home as long as possible.
Okay, that's really interesting. Yeah. So I also had another question. So it says you're finding ways to improve the healthcare system to make practicing family medicine easier. So what are some of those ways, and what have you kind of learned from that whole process?
Yeah, great question. I think there's three things. One is that one of the problems that we have in family medicine right now is there's 19 hours of your family doc's time that's spent doing non-medical care. Administrative paperwork, things like having to chase down referrals or having to over-document things that really shouldn't be in the doctor's hands. And so by really working on AI scribes or centralized referral systems and ensuring these products are, the technology that's involved is in the hands of the family doctors without necessarily having to download the cost to them. In addition, we know that within the healthcare space right now, it's very difficult to get referrals done. And sometimes as people are moving further and further away, people can't use their local connections as much. If I know that somebody's in Brampton, I know a lot of the specialists in my area, and I can kind of even give them a call and say, hey, this is a really important referral. I think this is the reasons why we need to see them soon. But as people move further and further away because they want to hang on to their family physician, I don't really have those local connections, and it can take quite a long time. And sometimes I just won't know about some of the great resources that are available in different areas. So we know that there's about 2.5 million Ontarians without a family doctor currently, And so that number means that a lot of people are very worried about possibly losing their family doctor. And so even if they move further away, they may travel the hour, 2 hours away to, I had one patient who traveled 4 hours to see me, 4 hours each way. And that was because they couldn't find a family physician, and they enjoyed the conversations we had enough to be able to feel like that was a worthwhile travel.
Yeah, definitely. That's a big problem. Do you have like any thoughts on like why that is? Why do you think there's like a big lack of family doctors in Canada?
Yeah, I think there's three reasons, and I think there's a important shift towards making some changes on it. But we know that there's a large group of family doctors that are retiring, and many of them are retiring a little earlier because they're not feeling like the system is supporting them. And so when we did a study, we saw that 65% of people were planning on either retiring in the next 5 years or changing their scope of practice. And so this meant that they were focusing quite a bit on how do I make sure my patients are well taken care of. So that's one group and one area of sort of reduction, if you will. But another thing we noticed is that because of these systemic barriers that currently exist, we're also seeing students and residents not choosing family medicine as a career path. And, you know, it's sad because I love my job. I love all the things I get to do, especially with regards to having relationship and competence and, comprehensive care with my patients. So focusing in on those areas, I think, is important because I don't think some people see that. So those are two reasons. The other one is the fact that people who are working currently are feeling quite overburdened with the work they're having to do. And so that 19 hours I mentioned, if they don't have access to things like AI Scribe, then that means that they're not able to really get that going and get that care going. And so they start limiting how many people they can see, how many issues you can bring to the family doctor. I'm sure everybody's seen issues where there's a sign that says bring one issue to your family doctor at a time. But that's sort of like wanting to bake a cake and only being able to buy one ingredient at a time.
Yeah, for sure. Just talking to like potential medical students, is there anything you would like to share on this podcast just about like why you think family medicine is such a good career to go into?
Yeah, I think it's great for a whole number of reasons, but one of the bigger reasons is the fact that you get to do exactly what you want to do. Meaning, if you feel like today's the day you want to focus in on procedures, you can do that. If you want to be able to work in the emergency room, you can do that. If you want to work and deliver babies, you can do that. So it's one of the things that when I was a medical student, I never really knew what I wanted to do. And I kept going to different rotations and realizing, oh, this is a great rotation. I'd love to be able to do this. So family medicine marries all of that, right? Like if you want to spend time focusing on the heart, you can do that. So I think that's an important thing. I think the other thing that sometimes is missed is that you get such a great relationship you can build with people. Some of my colleagues have been working for 30 or 40 years, have delivered multiple generations of people. So they're taking care of the grandmother, the mother, the daughter, the granddaughter. And it's a really cool experience that way. So I think that's one thing as well. And then I think the people, right? Like you get to work with nurses, nurse practitioners, pharmacists, dentists, dietitian, well, dentists too, but dietitians, social workers. And you really can build a good team around yourself. But I think that team is sort of on the backs of family doctors right now. So I think one thing that we're going to see and we're going to have to see is more team-based care in a way that is allowing people to build the team that their community needs. And I'll use the example of diabetes, for example. I can take care of a person from end to end on their diabetes. But of course, if I were able to bring in a dietitian to work with that person, and a nurse educator to work with that person, and a pharmacist to bring that person, the care is even better, right? And it's less time that I'm spending on one person and more time I can spend with multiple people. So it's not to say I don't love the care that I need to do. It's much more that we can actually do more together if we actually coordinate our care and integrate our care.
Okay, that's really interesting. Thank you. So I had another question. Do you think like the technological advancements and like artificial intelligence that are coming into the medical field, has any of that been implemented like so far in the medical field, which you realize in your like daily life? And do you think it'll make your job and your fellow workers' jobs easier going forward?
Yeah. So I think, with a lot of people, there's always this feeling like as technology advances, it's always going to be for the better. And I think that the thing is that everything needs to be done in a way that it's co-designed with the people who are using it. Just like with any product, end users need to be involved. And I think a lot of times when the early technologies were set up, I'll use electronic medical records, the actual charts we use to document everything. It was actually built for the ability to bill services and to make clinics and hospitals money. That's why it was created. It was never really used and meant to document encounters with patients. And so a lot of times physicians just kind of got shoehorned in like, hey, by the way, you're going to be using this documentation form. In addition to that, in the family doctor's world, we're paying for it. And so we're paying for something that isn't great. As we've gotten better with technology, something like AI Scribe and more importantly, ambient AI, where the AI is kind of listening in the background and able to predict based on what we're discussing, what the needs of the physician or healthcare provider is critical. That's really helpful, and it becomes great because what I don't want to see happen and what currently exists is great. The AI Scribe can listen to what I'm saying and document the encounter. That's a huge burden off me as long as it's accurate, which there's a little bit of training that'll go into that, but not much. But that's there. But what would really help, and what's present in some scenarios, not everywhere, and definitely not within family medicine, is something like ambient AI, where not only are you listening to the conversation and documenting it, but also recognizing that I just said this person with diabetes needs blood work, and give me the form that's already pre-populated so that I don't have to then go to the computer and click off, okay, I need you to these 8 things. And so if we can get to the point that that's the case and the imaging is done and a lot of these different things are already set up, it makes it easier to really take those next steps. And so that does exist. It's just not widespread, but it is definitely where we're going with things. So as we start seeing more and more that get more mainstream and is paid for, honestly, because this is going to be one of the biggest questions as we think about technology is if technology is like, hey, we have all these great things and it's in the private sector and good luck sorting out which is the best and which one's going to work for your flow, that becomes a big problem. Versus if it's a situation where here is a group of AI tools, we will pay to ensure that every family doctor has access to XYZ, great. You're going to see great uptake. It's going to create great benefits for patients. It's going to be easier to teach residents and students. It's going to make it easier to have those sort of conversations. I think a lot of people don't realize that when medical students and especially residents who graduate from medical school get into the field, it's more of an apprenticeship than a classroom-based model. And you need to be elbow to elbow with that person. And if that person's constantly turning towards a computer screen, something's going to get lost. So really allowing for that next step and the next phase to hit us early and also really already be paid for.
Yeah, for sure. So it's like kind of taking the burden off the main family doctor, especially since there's like a lack of them, like you mentioned now. AI will definitely really help with that.
Mm-hmm.
I just had another question about, like, apart from just your professional experience, did you have any other small experiences like early jobs or any hobbies that helped you and gave you experience to become a better physician?
Yeah, so I think I was always really interested in computers, computer science, gaming, things like that. And especially with sort of gamification, there's a lot of different things that I found that when I could include it in medical education or speaking with patients, things like that, it made it a lot easier. So staying up on the latest lingo helps because then I could talk to patients that are maybe your age or even younger and actually not feel like I'm the old man in the room, although it still happens. But I also find that gamification helps a ton. And a good example of this is escape rooms. So I love escape rooms. I think they're a lot of fun. So what we did was we created medical escape rooms where we could teach learners about really boring topics, things that you can teach in a lecture, but likely people will forget immediately. And make it fun, make it actually interesting. And by the end of it, you actually get what you're hoping to teach them and they remember it. And so there is some early data to show that things like that really does help. And we do know that gamification does help with remembering things. In medical school especially, it's always the more saucier, more spicier type of acronyms that people remember and rhymes and songs people remember. I'm not going to share any of them, but the ones that I remember are always the ones that are a little bit more on the not PC, not meant for general public thing, but those are the ones you remember more.
Okay, yeah, that makes sense. Like teaching it kind of like in a fun way to make them like remember it better. Yeah. Going back to like the AI topic, I was wondering like, do you think there's like anything in like that like an AI tool that you wish you would have in the medical field that would make your job a ton easier that like has not even been implemented yet, like anywhere really?
I think there's a couple of things. I think the problem when you say it hasn't been implemented is that there's always people doing things, but I'll say widely implemented. Okay, decision support tools are great, and I think what that is as I'm talking to somebody, and of course we're talking and we're hearing the AI. I'm using the ambient AI option here. That the AI is recognizing what I'm talking about, and it's putting into the chart ready for me to print, ready for me to pay attention to. The next step of that would be that in addition to that, because I've diagnosed somebody with something, instead of me telling the patient, hey, go and Google this, if it gives me a clear printout that's medically appropriate, that hits all the important things, but that can be translated, that can be dropped to a certain literacy level, and that can ensure that when somebody's walking away, they're getting something that they can kind of feel comfortable because their doctor gave it to them, but also maybe it's got some TikToks or Instagrams that actually are factual enough to be like, and these are some areas you can follow, some influencers that are doing great work that help with that. So I think there's sort of that next level of ambient AI where it's very similar to Jarvis from Iron Man, where basically I can almost talk to it and it kind of recognizes what I'm talking about and then kind of works to the next level. So it's sort of that next generative AI that actually has a bit of, not quite, let's not get to Ultron, we'll not get to like godlike AI, but maybe one step below that.
Yeah, for sure. That sounds like a really interesting idea. I feel like that definitely is going to get developed in the future as well. Now just moving on to like healthcare in general, how do you see it progressing in the future, and what would you like to see in healthcare in general?
Yeah, I always say that there's two experts in the room, and I think that's changing more and more. And when I say that, I always say that the medical expert usually is the person that's trying to give that advice, that information. So the doctor, the nurse practitioner, the nurse, the dietitian, there's always that expert that way. The patients need to really kind of own their own expertise in who they are, their family members. And I feel like we need to get really good at having that shared decision making. The only way we're going to be able to do that is by having information be as freely accessible and sort of as freely available to have conversations that make it really easy to know that both people are on the same level. And so one of the things I'd love to see happen is that as people are having conversations, that their ability to ask questions is as free as possible. There's no feeling of, well, I don't want to look silly or whatever. So the ability to kind of say, well, I don't understand X, Y, Z. Can we get it in a level that I understand? Is really helpful. And I think that needs to be the way we move forward. We know that when people are more in charge of their health and able to do self-management, their care is better. And so really having that advocate and that ability to have patients have the best possible information is critically important. So if I were to look at this, I would say that, like, I know people are going to go on Google, ChatGPT, on all these different things ahead of time. Great, no problem. Make sure when you do that, that there then is a freedom to actually have a conversation about it. That, like, one of the things I've been seeing more and more is people are doing that, and then they're coming with a set idea that this is what it is. It's not that I'm asking a question or trying to get the next set of care. This is how it is. And I think that shared decision making is where you're going to get a lot more benefit, because we really want to move away from an idea that patients are going to direct their care and really be patient-centered in the care and have that shared decision making. Because even as we see people get better and better with education of their own health issues, and get better at providing information on where it is, we also know that medical care is exponentially changing. And so sometimes it's actually hard for the physician to stay on top of it because it's staying so current. So a healthcare system where you're able to freely share information, be able to have the respect both ways, I think is going to be really important. And also where some of these tasks that currently are downloaded to physicians is starting to be a little bit offside. And also upskill the other professionals within the healthcare team. And so that's really important as well.
Okay, yeah, that's really interesting. So, I was wondering, like, what you mentioned, like, people, like, coming with a preset idea into, like, the healthcare area and then not really wanting to budge from that. So, this is kind of related to that. But have you ever found a scenario, or have you ever experienced a scenario where, like, a patient read something online, did something that you wouldn't suggest, and then the issue, like, kind of went on a worse scale?
Yeah, absolutely, 100% yes. So it happens a fair bit. And, I think there's some physicians who actually take that to heart. I kind of think of myself more as a concierge than a person who has to do what I say. We know the paternalistic version of medicine just doesn't work, and it actually puts people towards a feeling of an us and them adversarial role with healthcare, which is not helpful in anyone's case. So instead, if we can get to the point where people are willing to bring their information, that is actually really good. But I think there also needs to be an openness that, I'm not paid by pharmacy, and I'm not, or pharmaceutical, big pharma, and I'm not, against certain ways. But there is times where we have clear data that something somebody might bring into the healthcare setting may actually have clear harm, and there's data that shows it and all that. So I think that openness, being humble to both what people are bringing to the table, including their cultural background, their equity of where they are socially, some of those social determinants of health, that is really where we're going to have huge benefits, is when people are bringing their whole authentic self, being like, this is what I'm doing, and is it okay? Does it have any harm? Is there things that we need to do to ensure that when I prescribe a medication, that I'm not going to do it without knowing that's the case? Because there are times where something I'm prescribing and that could work very well could actually have a very harmful effect on someone else.
Yeah, for sure. Just taking it a step back, what really do you think motivated you to get into what you do today?
So, there's two answers to that, I guess. One is what motivated me to get the medicine, and what got me to family medicine. I kind of talked about the, liking every part of my rotations and that side of things. So I think that's my family medicine side of it. I'm the first doctor on both my sides of my family. And I think it's funny because I think everybody kind of thought I was going to be a computer engineer because of the fact that I loved all the computer stuff and I was really good at it and all that stuff. I really liked the idea of service over self and really focusing on how best can I help others. And to me, when I saw it in the healthcare system, it was clear that the people who were really caring and wanted to help, they were the ones who, in my eyes, were heroes. And I'm a big comic fan, as you might have told from earlier comments, but That superpower mentality was kind of something I saw in healthcare, and that was my own personal interest. Is I really like this idea of being able to be the one to help someone. And as a family doctor, sometimes something as simple as being able to wash somebody's ear out and clear the wax from their ears can be like, oh my God, I feel so much better. So there is a feeling of that. There's also the idea that like there are times that I feel like some people who are great humans make amazing doctors. And I find that when we get to a situation where the best humans become doctors, we actually get the best possible result. So, I think this idea that when you focus in on the most important kind of aspects of why people should choose medicine, it's because of that feeling of wanting to be of service for others, and really being able to focus on the ways that you can provide your whole self.
Okay, yeah. Thank you for those wonderful insights. It was wonderful to have you here today. Thank you so much.
My
Have a
absolute
great,
pleasure.
yeah. Thank you.
Thank you.
My pleasure.
Have a good day.
You too.
Have a
Bye
great
now.
evening.
Thanks.
It's wonderful. It's wonderful. Thank you.
Bye, guys.